Namibia is well ahead of many African countries in making maternity care to majority of its population, yet maternal and newborn mortality still remains high. This worried the WHO as to why the maternal mortality rate is so alarming despite the maternal health services available at all health regional centers countrywide. Data collection has shown that only 73% of births to women in the lowest wealth quintile were delivered by a skilled provider, in contrast to 98% of births to women in the highest quintile. It has also been observed that only 80% of women living in rural areas delivered at health facilities centers, in contrast to 94.7% of women living in urban areas.
Pregnant women from rural communities must travel substantial distances, often over 100 kilometers, to reach the centers. Some set out but have left too late and give birth along the way. Others arrive when complications have set in and it's too late to save the baby or the mother. It is therefore important to ensure that pregnant women have guaranteed access to antenatal care, childbirth care, and postpartum treatment administered by highly trained healthcare providers by means of maternity waiting room, for example. I have said it many times before, and I will say it again today to you: no mother and pregnant women or baby deserve to die.
10 or 15% deliveries in Namibia take place at home without adequate and timely critical maternity care, predominantly in the rural areas. In his official address, the Minister of Health and Social Services, Dr. Bernard Haufiku, said without access to any public transport, impoverished pregnant women from rural communities are traveling substantial distance of kilometers. He said that is why his ministry had prioritized health field workers who would be taking medical attention to the rural communities instead of them coming to hospitals, which is 100 kilometers away when they have complications.
That they educate the community right there in the community where they live. So it looks like I'm now shifting emphasis from maternal mortality, but it's both. And in fact, we can prevent maternal mortality by strengthening the community health system. I've seen it in Ethiopia working. Ethiopia was very, very, very aggressive. I was there just about 2 weeks ago, and they have trained more than 35,000. And Ethiopia is a bigger population than Namibia. There are about 90 million people in Ethiopia. And 87 people, or percent of those people, live in the rural area. So we can do it together.
Dr. Haufiku also said his ministry would be strengthening service delivery at district hospitals to minimize unnecessary referrals. Haufiku also assured the nation that his ministry would continue providing quality health care to the people.
Whereas in the new structure, we provide for ambulances, drivers, cleaners, clerk, etc. in all these facilities. So it's very, very crucial that we restructure. I actually never understood, I didn't understand it initially, what is this restructuring about? But it's the key to improving our performance.